All right. Good morning.
Good morning, everyone.
This is May 31st, last day of May. May, as some of you may know, it's Mental Health Awareness Month. Uh, I'm Mario Mendez. I'm a licensed mental health counselor with Found Care.
My name is Sophia Lopez. I'm also a licensed mental health counselor working at Found Care.
Right. And we're here today just to talk a little bit about our experience in treating mental health, especially as it relates to some of the cultural aspects that we see, some of the barriers, the stigma around mental health. If we look back at where we come from in terms of treating that, and a few centuries ago, where mental health was seen as a disturbance of your spirituality, right? Something was going on with that person that has been taken by the demon. She was a witch, whatever that is. Let's separate them from the community. You'll be put in asylums. You'll just be there for the rest of your life. Just don't bother us. Let us, normal people live our lives, right? So we have come a long way from that, but we're not quite there yet. We still have a lot of growth, right? I wish sometimes that people would look at mental health at the psychiatric field the same way as we look at other fields of medicine, right? Where you go to a cardiologist and the patient is over-reporting symptoms because they want the doctor to know every single thing that is going on with them, right? And it's interesting to see because many times they go there and they over-report those symptoms, and the cardiologist is saying, well, you should go see a therapist. What you just experienced was a panic attack, right? So we are more likely to look at the medical stuff first than the mental health, as if they are two separate things, right? So now we see a more integrative system where, especially at Found Care, we do that well. You go for a consult with your primary care physician, and perhaps during that consult you say, I have been feeling more anxious than usual. I have been experiencing these problems. And the primary care physician is perhaps the first person that's going to be listening to that problem. And they're like, well, let me connect you with Sophia or with Mario or any one of our amazing therapists in our team here, right? And so we're trying to break down some of the stigma around that, how we can reach out to more people. I think it's already difficult enough for people who wanted the help to find the help. Imagine when we have some of the cultural barriers, right? People that some people until today, they don't believe that mental health is a real thing because they've been told that their entire lives, right? So if you have anxiety or if you have depression, people are telling you that you're not trying hard enough to be happy. You're not putting enough effort to calm yourself, right? And these people start thinking, well, I guess I am the problem. And if I am the problem, nobody can help me. And what we're suggesting in this conversation today is that let's start looking at those symptoms the same way that we look at a fever, right? That you have a fever and then now you go to the doctor and say, hey, find the infection for me. What medicine do I need to take? Because we have come a long way. There is treatment that is very effective, right? I remember when I first started working with mental health, if you have someone who is schizophrenic, this is someone who is never gonna be able to be part of our community. Luckily, I had the opportunity to work with several patients that suffered from schizophrenia, got the right treatment, and if you go out there and you run into these people, you have no idea because they are asymptomatic, they are in remission, they are compliant with their treatment, and you just won't be able to tell the difference, right?
Exactly. I just wanted to play off of what you mentioned with the medical part and how the physicians, the primary cares, are usually the first ones that people will find. They'll have that interaction and they'll they'll hear that feedback from their own doctor saying that, hey, this sounds more like anxiety. The assessments, the tests we're running, you're all good. Physically, there's nothing wrong with you, but maybe you should check, to see, to get better control or manage your anxiety a little bit more, or even with the depression. So I think when culture plays a huge aspect in terms of becoming a barrier to treatment, it's also super helpful to actually accept this feedback from your doctor. I mean, they're doctors, right? They know what they're talking about, and usually cultures will definitely listen more to their primary cares, and hopefully follow their recommendations or their referrals. So going into kind of a little bit of statistics, some research to give you guys more of an understanding of the people, especially with culture, the ones that are actually seeking treatment and the big gap we have. So according to NAMI, which is the National Alliance on Mental Health, they provided a study that shows about 5 to 16% of people of color with a mental health diagnosis will actually seek treatment. So let's look at the other way. So that means that about 95% are not accessing treatment. That's a big percentage. So providing, also looking at the providers. So the people providing the treatment, the therapy, the services, according to the American Psychological Association, it shows that only less than 15% of these providers are people of color. Breaking it down further, that means that 3% are Black, 4% Hispanic, 3% Asian, and 3% other. So these people that are seeking treatment, right? So the small percentage is 5 to 16%. 95 to 98% of this population of people of color will actually drop out after just one session with this therapist, psychologist, prior to achieving any kind of treatment outcomes, any treatment goals, any progress. Because if you think about it, the majority then are really sitting across from a provider that doesn't look like them, doesn't feel like they're understanding them. That will be a huge barrier. And when we look at what can happen when mental health concerns, illnesses go untreated, specifically making the population of people of color more vulnerable to things like substance use issues, homelessness, homicide, suicide, and even incarceration as well. So we see the importance of seeking treatment and kind of sticking through it as well to really see the progress.
Yeah, so these are vulnerable populations, right, that we already know the difficulties in accessing services.
Right.
And then you throw on top of that the stigma about mental health, and that really complicates things.
Definitely.
Right? Because I don't want to be the one who is seen walking into a therapist's office.
Especially in certain cultures where if you are the one being seen walking into a therapist's office, what is my family, what is my community going to say? And when we look at any other culture outside of the Western, our Western in this country, it's very individualistic. So outside of this, cultures are usually more community-based. And a lot of times what will keep people, like exactly what you're saying, Mario, from doing that is being shamed, judged, criticized by their community, by their family members. When in reality, one of the big changes that we're seeing, like you were saying, how we've made this very big change from the beginning of therapy and psychiatry, is allowing the client to come in with their culture, with their spirituality, and using that within the therapy and within the treatment to seek their goals.
Yeah. And so I was remembering now of how even the practice of psychology, some of the places you might go to, you have one entrance and then you have the exit, right? Because you don't want people to see you leaving a therapy session, right? You don't want run into other people, right, in that setting. And I remember having one trainer that once told me, well, I want people to know how much they got help. I want them to go out there and talk about this.
Right.
Because that's how, plastic surgeons, they are very good at their marketing, right? If you like the result, go tell people that you got that plastic surgery, right? Tell them about this. And with mental health, there's still that thing that even the people that got help, sometimes they are hesitant to tell other people of how they got the help that they needed, right? And with that creates another barrier, right? Because people who are suffering, they're usually suffering alone, right? They are not, even within their family system, they are not likely to go and tell their parents how they're feeling, right? So it requires somebody to see it and encourage them to get help. Then many times them just saying, "Mom, Dad, I'm struggling with depression. I'm having suicidal thoughts. I'm having urges to hurt myself," because they're afraid of how their own families are gonna respond to that. So this whole thing starts within their families, but we also have to take a look at how we do that as professionals in this field, how we're treating that.
Right. Definitely. Going off of the whole family thing, that's a good point also to bring up when we talk about culture and where it starts, right? Our traditions, where we learn these traditions and our points in culture. It's definitely within childhood when we're brought into this world, right? Our caregivers, what they teach us. One big point I want to make about this is this term called emotional inheritance. And this term actually talks about how you learn to express your emotions during childhood. And I don't know if you want to share a little bit about that, if you remember learning about that.
I was talking to Sophia how, I was born and raised in Brazil, big family, and talking about your emotions and talking about what's going on with you is just not something that you would do. One of the shocks culturally coming to the United States was seeing how people would say "I love you" all the time, right? It's, oh my God, that kid needs to hear that "I love you" 5-6 times a day because their parents are worried if they don't say that enough, that person is not gonna be okay. And then in their relationships, they need to have that validation all the time. And I was like, oh my God, in Brazil, for you to say those words, that means a lot, and it takes a lot of work to get to that point. It's just not something that you see done on day to day.
Definitely seeing the difference in cultures there. And when we talk about when children are learning to, developmentally, this is a very big part of phase where people are learning these kinds of things like expressing emotions, behaviors. So when children are expressing their emotions, such as certain emotions like sadness, frustration, or anger, in certain cultures, that'll be perceived as defiant, oppositional, right? There's something wrong with my kid, put him back in his place. What happens is then disagreements or conflicts within the family, within family members, would often lead to the child kind of minimizing the child's emotions, their feelings, right? So that's where we hear the expression, children are seen, not heard, right? Have you guys heard that? This is going to affect, it's going to have a very big impact on how the child learns to not just express, but what are emotions and how other people, how the world will respond to when I express them. So this could also become a barrier, and it will become a challenge when this child grows up and becomes an adult and wants to seek or ask for help emotionally.
So if a child is not encouraged to even share the positive emotions, right, then they're less likely to be sharing about their negative emotions. Right? So they're not likely to be telling how they are suffering.
Right.
We see kids that go to school and they might be a victim of bullying, and they're not likely to come home and say, hey, this is what's going on, because they might have learned, well, I'm supposed to be tough. I'm supposed to stand up for myself. Right, so that vulnerability is often seen as a weakness in culture, right? Yeah,
and we still see that today. We're still really trying to change that, but there are still challenges that we face. A lot of that when we look at the negative stigma now that we're touching on that, we were actually talking about like celebrities, right? We see that especially because what Mario was saying, individually, just a person going out and seeking treatment, just thinking about it is a very big step. Imagine these celebrities speaking out. You mentioned.
Last summer Olympic Games, right, that Simone Biles withdrew from the competition, and many people were looking at that as, oh my God, she has courage.
Right, very brave of her.
And some people were criticizing her, saying, well, she's representing our country, she should go there, she should fight for the medal, and they're not keeping in mind of all the events leading to that, right? Which is, public information that she was a victim of abuse. She was dealing with the consequences of that abuse. All of those memories coming back and having to deal with that in court. We're losing a little bit of that humanistic side.
Definitely,
right?
Yeah.
So, and this is, I think the United States especially, and when you look into Florida, the variety of cultures that we come through, right? And we have to keep in mind when we're dealing with that, because I think that's another aspect that people are hesitant to come and get help, because they're thinking, well, would they understand where I'm coming from?
Right. And we see that even when now what's changing is even going to school, and our training now actually involves, and it includes the being culturally sensitive and considering this. So back to what I had mentioned earlier about the client having more control than they really think coming into therapy. They have the ability to integrate and incorporate their culture, their spirituality, in order to make that progress. So when we talk about seeking help, right, individually, you as a person with your therapist or your provider, you're really looking at your own individualistic goals. So that might give you a feeling that you're being cut off from your community, when in reality what we really want to do is integrate that culture, that spirituality, and giving you and using that, because a lot of times we see that community is a big coping skill. It's a big coping mechanism for a lot of our clients, and we want to play on that. We want to use that. Yes, so and another thing I wanted to mention about families and how culture could really affect even seeking or continuing with mental health treatment, medical records, right? My child, I see this a lot with families. I don't want my child to, not get into this medical program. I don't want my child to not get this job. I don't want this to follow my child into, their future. What if they find out that they have been on this medication, that they've been seeking therapy for X amount of years? How will this impact them?
Yeah, and that becomes a clinical issue, right? Because it comes to the family to decide what's more important, right? How this information can people see it later, or how do we actually treat the symptom, right? We want to treat the symptom. So you might have nothing on the record, and your child is still suffering from depression and having to deal with the outcome of that, right? As I tried to make clear at the beginning of this conversation today, that people are not choosing to feel depressed. People are not choosing to feel suicidal. And yet we're seeing that happening over and over again, right? I think that it has always been there, but especially with social media nowadays, where it's just that's on our face all the time, right? And unfortunately, people are likely to bring out mental health in moments of tragedy, right? Recent weeks we've seen 2 shootings. And first thing that people point out is, oh, it's a mental health issue.
Right.
So that's another problem, because we're only bringing and talking about this at the times where there has been a tragedy. And I think that's what we're trying to break from, that is stereotype, is that the month of May is like, let's talk about this all the time. Let's talk about this when there's not a tragedy going on.
Right.
Unfortunately, we have seen tragedies, and we'll be talking about it. But we want to change people's mentality.
Right.
We want to change people's approach, right? Because yes, a lot of these issues could have been avoided if people were getting the help that they need.
Right. So speaking about it would also be in preventative measures, right? We see that, and I think going back into, what you were saying about really deciding what's more important, your child or your own mental health, versus opportunities for the future. What you mentioned was a very good point about if mental illnesses or mental health problems go untreated, what would that look like for the future, right? When we talk about outcomes in the future, over medical records, when in reality medical records are private, right? You have the ability to decide what records to release and when. So I just kind of wanted to talk on that mythbusters. And again, I think culture, what it does when we talk about this is a lot of cultures like to keep things like feelings, emotions, problems very personal. It's very within the family or to yourself, right? We don't speak out about it.
Yeah, we'll see families that this is a family issue we're resolving here. So, and which also creates that idea that everybody's family is well put together, only mine has a problem, right? Then no, it's that people are just not talking about it.
Right.
So if we can encourage people to be talking about these issues and that connectedness, one thing that I'm passionate about doing group therapy is that sometimes you see how listening to somebody's story that can be very similar to yours, and you can relate to that, and that thought just occurs to say, oh, I thought it was just me, and you start connecting with other people, and it's through that human connection that we start eliminating some of this stigma, some of this bias against mental health, right?
And finding that sense of hope again as well. It's not something that you are internally battling for who knows how long. And when you start to see that others can relate or that you can relate to others, there is that sense of hope that it can be overcome. So how, when we talk about all of these barriers, how do we address them, right? Like, where do we start? Where do we really want to start breaking it? Well, we talked a little bit about awareness, education, right? Not educating just individually, but maybe the family, if we're seeing a child, if we're seeing an adolescent, the whole. Another thing that I believe you mentioned in the beginning about showing up to a doctor's office and the doctor telling you, hey, you're fine physically, but maybe you should, think about therapy or seeing a psychiatrist. So mental health issues can present very physically in someone's body, right? Especially if we, like you were saying, we don't express, when we don't really work on these things, we'll start to see it really affect us physically and behaviorally. So that's actually, I think, a really good transition, a really good first step into kind of breaking down these barriers. Is it's much easier for a lot of us, multiple cultures, to kind of look at mental illness or mental health as, okay, how does it present on the body, right? You're stressed out. How does stress look like to you, right? Are you sleeping? Are you eating? How's your energy, right? Your cholesterol, your blood pressure, all of that might be fine, but you're still not sleeping, your appetite's up and down, and you're feeling fatigued all the time.
And that's where we want to balance, because when people are interested in treating the physical symptom, they are likely to go and just ask, give me a medicine, right? And they really want to go, give me the quick solution. I can take this and I can sleep tonight.
Right.
I can take this and I can lower my anxiety, right? So we also got to have that balance where we're educating people that, there's something called also mental wellness, right? And we want to be practicing that, right? We're so encouraged to work, and often in sessions, the topic of self-care comes up. And people are like, well, that's good to hear about that, Mario, but I don't have time. I don't have the time for that. I have 3 kids and I have a work and I have all of this going on. And we get that, but those are one of the things that if I don't take care of myself in preventing it, right? That's when treatment can be so much more difficult.
Yeah. So if you see yourself as being part of a culture, a family where emotions are not an easy topic to bring up, maybe start by looking at how the emotions are presenting physically in your body. That could be a very good first step, a transition into really seeking and normalizing that mental health care. I see that a lot, especially with families with mixed cultures, right? The child or adolescent will be ready to go into therapy. Mom, I want to see a therapist. And the parent's like, what? For what? Right? And then maybe that could be again a topic of conversation, just looking at what your lifestyle looks like right now, looking at things like sleep and appetite, and then kind of easing your way into how the emotions are really kind of piling up and affecting you behaviorally. So awareness, education, and communicating it.
So in a way, some cultures believe in mental health. Some cultures don't believe in mental health. But the way I look at this is it doesn't really matter your belief, because it's one of those things that it doesn't really matter if you think that the planet is flat or if it's round. There is an answer for that that's independent of your belief. So if you find yourself in a cultural environment that has questioned mental health, the psychiatry field, and you're saying, well, this is more of a spiritual problem, this is more of a person problem, the illness, right? Major depressive disorder, bipolar disorder, schizophrenia, those things, they don't require your belief to be taking place, right? But sometimes that belief does prevent us from going and get help that is available to it. Right? And so if you find yourself suffering, right? You find yourself stressed, anxious, depressed, right? You start asking those questions of like, what might be going on with me, with my life, or how I can get the help that I need. Like I said, if people were talking more about their positive experiences in treating those symptoms, perhaps the stigma about it wouldn't be so bad, because we'll be hearing the successful stories. Right? And you mentioned briefly earlier about substance use disorders, right? And some people still separate mental health and addiction. Addiction is a mental health disorder.
Definitely.
Right? Perhaps one of the most severe of them, because it's affecting your judgment. People are not choosing to be addicted to a substance. I don't think people are choosing to relapse, but that is the evidence of how strong that illness is in driving that behavior, right? So mental illness, you might see that represented by behaviors, right, that are maladaptive, that are hurtful to yourself and others. And like I said, I don't think people are choosing to be feeling that way.
Yep.
Right? So any final thoughts, Sophia?
No, just something that we've mentioned at the beginning, we've come a long way in this field, and the psychology in general, but there's still a long way to go. I think just working together really and talking more about it, bringing awareness is the first step. Also knowing how connected the mind and the body really are, and really listening if it's something that maybe you just really haven't considered. Just like you were saying, if someone is not choosing their mental health issues, they're also not choosing to neglect them. Maybe they're just lacking that awareness. So really listening to your provider, if it's your primary care that brings it up for the first time, right? Really like looking into that and seeing, okay, well, if physically they're telling me and I'm feeling it physically, right? My heart rate, my shortness of breath, and they're saying my tests are fine, looking into maybe anxiety, how I can better manage that, how I can better control that, knowing that the mind and body very connected, right?
Right. Yeah.
And
I want to appreciate everyone who might be watching this video, listening to this video, and the role that you play in spreading the word, right, and letting other people know that there is a solution out there, right? And so many people have suffered for so long, and they're like, well, I didn't know there was something that could help me.
Right.
So let's go out there, let's talk about this on the good times as well. So,
yeah.
May being Mental Health Awareness Month, let's talk about it when there are good things happening as well, right?
All year long, guys.
Yeah.
We apologize. We were going to leave some room for questions and answers at the end of the presentation. We had some technical issues with our live stream, so we had to do this via video, but we look forward to doing this again, and hopefully next time definitely giving you guys a chance to ask some questions, and we'll follow up with them.
All right.
Alrighty.
Thank you.
Thank you.